Welcome to the show. Let's talk health with Dr. Yash Gulati. The word cancer, very mention of this word puts a fear of God in one's mind. But what people don't realize is that if cancer is diagnosed early, some of them can be totally curable and many of them can be very controllable for years. To discuss this issue, we have with us a very prominent cancer surgeon, Dr. Harit Chaturvedi, who is the Director of Cancer Surgery at Max Hospital, Delhi. Dr. Chaturvedi, as I said, कि कैंसर का नाम लेते ही कम कभी छूट जाती है.
सही बात है.
तो इससे बचने के लिए early signs, what are the early signs or warning signs that people should look for?
So actually what you said is very true, that it instills fear of death in people's mind, and the moment you are diagnosed, it looks like a death warrant. So what people need to know is that almost 50% of cancer is preventable. It will not happen just because of lifestyle effects. For example, use of tobacco is directly attributed to 35% of cancers, oral cancer, lung cancer, all this because of tobacco. Likewise, weight gain, that is also an important predisposing or cause for cancer in uterus, colon, breast, and so many things. So if we have a healthy lifestyle, we can prevent 50% of cancer. In the remaining 50, almost more than half can be diagnosed early just by being aware and alert, as you very rightly said, that what are early signs of cancer. So one is that 3-4 cancers are screenable, so to say. That means you can screen healthy population and pick up in a pre-malignant stage or in a stage where it can have almost 100% cure rate. For example, breast cancer screening, mass screening with mammography is very
advanced. Has that helped a lot, breast cancer
screening? That has helped a lot in European population. In India, there are challenges because the incidence of breast cancer is a decade earlier compared to Western population. And second thing is that in that age group, the breast tissue is more dense because of glandular tissue. So it's not that well screenable. Having said that, there are a lot of studies to prove that being breast aware, being alert that any change in the breast should be taken to a doctor. All this has led to early diagnosis.
So what can a lady do? They can do self-examination.
So if I give you just one data point, that in about early 2000 or late 1990s, the average size of breast lump in an oncologist clinic was about 5 centimeters. Today it is about 2 centimeters. That itself reflects the awareness level, what has happened. And as you said, what are the early signs, what a lady should look for? I think the most important factor, I would say, is that being aware of your breast. That means under the shower, whenever you get a chance, you just palpate your breast, maybe once a month after your periods. That is when there is least fluid in the body, and so one can comfortably evaluate any change, a new lump, a new density, or new skin change, or a nipple retraction, or a nipple discharge, or even sometimes pain. However, pain is only a symptom of 66% of breast cancer patients. So it is not the main symptom. Main things are lump, nipple discharge, skin discoloration, feeling of a lump in the axilla. Any new change in the breast is an important indicator to visit your clinic. Similarly, for whole body, any part of the body, any new symptom for more than 3 weeks should be taken to a doctor to rule out cancer. The reason I am saying this, because cancer symptoms are not unique, whether it's alteration of bowel habits, whether it's blood in the motion, or an episode
or even the way you talk,
change in voice, or occasional cough. So as you know that, or an oral ulcer, so everything to start with looks very similar to a benign condition or a non-malignant condition. However, if a symptom persists for more than 3 weeks, the question should be, is this cancer or not? For example, if somebody presents with bleeding per rectum, blood in the motion or stool, common label is this must be piles, and so people don't even look for reasons. So I would say, whether it's this, whether it is a change in voice, whether it is a ulcer in the oral cavity, whether it's a lump in the breast, upper abdominal pain, discomfort, alteration in bowel habits, any new symptom.
And what your weight? Does that also?
So weight loss is a symptom of advanced cancer.
Advanced.
So I really want to focus that please don't wait for weight loss.
That's too late.
That's too late.
Yeah.
That's a symptom of advanced cancer. All early cancers, you will have very vague symptoms and nothing to suggest cancer. In fact, people come to us with all the reports. सब कुछ normal है तो cancer कैसे हो सकता है? So these normals, reports of hematology and biochemistry will not show any change in cancer.
And it is very important to diagnose this very early.
Yeah. So all cancers in a general way, I would say, in stage 1, the cure rate is close to 90%.
That's tremendous.
That's tremendous. So if you look at breast cancer, almost 90-95% cure rate in stage 1. Likewise, whether you talk of colon cancer or oral cancer or food pipe cancer, any cancer, it hovers anything between 80 and 95%. Stage 2, it goes down 70 to 85%, depending on the tumor site of origin, the tumor type, biology, and today there are so many new things happening like genetics and immunology and precision medicine has taken over the modern oncology. I would say taken over in the sense that they have provided new direction to treatment and planning.
Yeah. Dr. Chaturvedi, you just said that, and I fully agree that early detection, being paranoid about it, so that we don't miss it and diagnose it early is of paramount importance. But what happened during this corona pandemic? The whole concentration went on to corona as if there was no other disease.
Absolutely.
So do you think that had a bearing on early diagnosis of cancer?
Huge bearing. So I will say it affected treatment in 3 ways. The corona pandemic when it started, and in fact we wrote a petition to the government also from our oncology forum, and within the hospital we met so many ministers and everybody. We wanted to push this agenda that oncology cancer cannot wait, and that was really understood and appreciated. However, the fear of corona, or the scale of pandemic is such that it can suddenly escalate and go out of hands. So therefore, there were a lot of constraints in the whole situation. Having said that, I think corona treatment, cancer treatment during corona also was the earliest to take off, and still I would say it's moving at a reasonable pace. So as I said, it affected in 3 ways. One was a lot of people who were on treatment got interrupted. People who were getting
there was actual interruption of treatment?
Yeah, interruption of treatment. People who were while on radiation, suddenly there was a lockdown. Even when the lockdown was opened, there was so many restrictions to travel, so many issues came up. Interstate transfer of people was a challenge. So that was one situation. Chemotherapy got interrupted, surgeries planned got interrupted, and all this interruption went on for about 3 months. After about 3 months, that is end of March to end of June, there was a problem. After June, it started getting normalized in certain ways. Second interruption happened for people who get diagnosed in their clinics. As I said, the cancer symptoms are not unique. So typically, all diagnosis of cancer starts from GP clinic, where people go with vague symptoms. They don't land up in an oncologist clinic.
So it's important even for the GPs to be aware that
absolutely
every small symptom may be actually
they are our partners in this war.
Yeah.
So we repeatedly say this: cancer is not something which oncologists will solve.
Yeah.
If cancer has to be solved, it has to be a mass awareness. And believe me, the way things are going in next 5 years, cancer is the pandemic.
Yeah.
What you saw as COVID as the pandemic, it's out and over.
And
it's
is
getting
our
over.
country, there are more cases of cancer than others, or are we same percentage as
So we have
different
grown
countries?
significantly. So US, the risk is almost 3-fold higher than India. As our economy will improve, the cancer incidence is going to go up. That's
why is that?
That's very unfortunate. As I said, lifestyle influences. So both the weight gain increases with economy growth, because people have more unhealthy food, unfortunately, because of maybe better affordability or whatever, less exercises. They all come in a package. Okay. Likewise, smoking, use of alcohol.
So really, simple living is a better living.
So if you can hold on to our cultural values and simple living and still grow an economy to solve the problems of the masses, that is the way to solve the problems.
That is the way.
But this is unfortunately doesn't come in a package. So if you look at the economy and cancer incidence, it goes up. So we are at a very low in terms of incidence, but we are at an explosive point, because there's almost in next 5-7 years, we are sitting on a bomb where it will become a pandemic.
And how many cancers go undiagnosed in our country? Because a lot of people live in the periphery, they can't even reach major centers.
As you will appreciate, undiagnosed means there's no data.
Yeah. Or you don't know.
So there's no data. Undiagnosed means no data. So if I look at the pattern and the incidence, I would say that data-wise, we are almost at the same level in terms of population-based risk. It's about 130 per lakh per year, new cases getting diagnosed in India. The same number in US is 450.
And is our country geared to solve this problem in time to come, and geared with this increased load of cancer?
So I feel that we are getting geared. when I came to Delhi in 95, in the whole of northern India, there were about 30 odd centers. And Delhi alone had only about 6 centers, including AIMS and Safdarjung and LNJP all put together. There was this Batra Hospital, and there were a couple of centers. Rajiv Gandhi came after that. Dharamshila was there already. So there were only about 6 centers, all inclusive of private and public. And the whole of North India had about 30 centers. Today, Delhi NCR has 40 cancer centers. So I can very humbly say that we are getting geared. The society is empowered. There are a lot of professionals getting trained, and opportunities are coming up. People are collaborating together. The methods of treatment have changed. Today, the culture of tumor boards and collaboration is much stronger compared to what it was 25 years back or even 10 years back. So I can say that the oncology community, the medical fraternity, and the government is putting a lot of weightage to this. This focus on non-communicable diseases by the government of India is also an important aspect in this whole journey. The coming up of NCI at Jhajjar will have a game-changing effect. Setting up of about a dozen centers across the country by Tata Memorial is also an important thing, and private sector has brought a lot of focus. So all this is coming together.
You know, Dr. Chaturvedi, sometimes I wonder, there is a dichotomy here. There are lots of patients who come from 30, 40 other countries for treatment here, including treatment of cancer. Yet, some of our own patients who have more money or more facilities, they tend to go to some centers in some other countries, including some of our leaders. Do you think there is a need for that, or do you think we are as good as anybody else in the world?
So this is a very difficult question, because
I know. I'm not going to ask you simple questions.
Because as a professional, I feel that we are quite well geared. As well, with hand on heart, I feel that there are a lot of things to do and improve, and there are better ways to put the collaboration and better structure in place. So my question always to my own team and to wherever I've worked ever is that what is the take that a person who walks into your clinic at the reception gets routed the best possible way. Unfortunately, most of the places it lands up that you have to be with the right people in the right team. So as we will improve the base of professionals and the numbers and the excellence and culture and all that, I must also say at the same time, it doesn't mean that going out ensures good treatment or going out is the right thing to do, or people who get treatment here are getting second-hand treatment. I can say with all humility and confidence that almost 85-90% people get standard of care, best care, because they are getting treated by the teams which are fully trained, professionals cared.
Yeah. Is there a culture of super specialization within cancer community here?
Thank you for asking this question. Actually,
it's very important.
I think you have asked something which I'm a big, I can say, exponent of this. So what we have done at Max is what is called DMG based culture, disease management groups. For example, in orthopedics, we have got 2 people who do only orthopedic oncology, Dr. Akshay Tiwari, Vivek Verma. They are musculoskeletal oncologists. Likewise, we have got a uro-oncology team, Gagan Gautam, Puneet Aluwalia. We have a thoracic team. We have a separate breast team. We have a head neck team. We have a GI team. We have got 4 people dedicated GI oncology from surgical side. So there is...
That is the way to go, isn't
There is not just a need. This is the thing which will take us there, that people will... And not just for surgical oncology, including medical, radiation. So when this specialized team sits together and talks together and makes a treatment plan, it can match the best in the world. So the generalist approach in oncology has moved to specialized,
like
further
you said,
specialized
you
approach.
Keep your hand on the heart and say this is right. Like in orthopedics, I know I can't do everything in orthopedics.
Yeah.
So there are some specialty in my specialty. Similarly, I was wondering whether you are developing that. I'm very happy to know that that is happening, and that's the way to go. So yes. Ladies and gentlemen, it's very important. Dr. Harit Chaturvedi also emphasized that we nip it in the bud. We catch it early, diagnose it early. Any change in habits like voice, severe headaches, change in bowel habits, weight loss is very late. So this, any change in habits must be reported to the doctor so that we can catch this evil early and treat it, because many cancer patients can be cured of cancer if the diagnosis is done early. So please look after yourself. Any change in habits, please discuss with your doctor. Thank you very much.
Thank you.